warm welcome to our session, a session about collaboration, implementation, upscaling in the Central, Eastern and Southern region, the Balkans, etc. So let me first explain you a little bit about the roadmap of the session. And the session is a joint effort, jointly organized between Net4Care, which is a public-private initiative focusing on transformation, improvement of healthcare systems in this region, along with the Southern Eastern European Health Network, a branch from WHO. And later on we come to this in the second part of the discussion with the panel. And this is also co-organized by the European Health Union Initiative. Of course, you heard this already during the whole conference. So we will touch upon the different matters of this session on collaboration, on an EU level, on a regional level, and at a local level. So we start in the first part, from a professional and a patient point of view on how improvements, working on healthcare, efficiency, accessibility, etc. The second part is about regional collaboration, cross-national collaboration in the region, and also the importance of public-private partnerships. And then in the third part, we talk more from an EU policy point of view, European Union, but also a pan-European region perspective. So as you can hear, we have the different levels in place, and which is often very important to make eventually healthcare at the local level work. We are very much dependent also on at the national level, the European level, even international level. So we will take you with us through the journey we have been taking over the last couple of years with very concrete examples. We have, after each part, we have room for questions, for discussions. We also have Slido. Philippa will help us with monitoring questions and discussions online. So we're also looking during the discussions to Philippa. So let me introduce you the first speaker, and this is Nicoletta Antone from Cluj in Romania. And Nicoletta will tell a little bit about the professional point of view on what does it take from a professional point of view, how to realize person-centered care in a setting where you have different actors at the local level. And please tell a little bit about yourself and your ideas.
Thank you for inviting me here. So I am a breast medical oncologist. I'm the head of the Breast Cancer Center in Cluj-Napoca, Romania. And I would like to share a little bit of our experience. So just to give you a little bit of perspective, there are around 18,000 new breast cancer cases in Romania every year. And about 1,500 are presenting to our center. So on the other hand, we have these studies that have shown that if patients are treated in a multidisciplinary approach, this could lead to an improvement in overall survival, about 10 to 5%. So knowing all this, we have had an internal decision to have the first breast cancer center in Romania, and we also wanted to have an external assurance, and we applied for an international certification from the Cancer Society, from the German Cancer Society. So the process is still ongoing, and I would also like to discuss a little bit of the barriers that we are facing, obviously. So we wanted to increase the multidisciplinary approach in our center, and for that we had to update our institutional protocol. That was one of the main issues. On the other hand, we also had to have a more structured software for tumor documentation, because actually we didn't have any form of data input where we could store our data and obviously analyze it at some point. On the other hand, we also knew that a breast cancer center is a network of specialties, right? So everybody's involved, starting from surgery, medical oncology, radiology, radiotherapy. So we also need some sort of form of legal administration for our center, and this is also what needed to be put in place. And of course, there were other barriers. We needed a schedule coordinator because this was also an issue, as everything was a little bit chaotic before. And we needed a new platform for our new MDT meetings. So step by step, we have done this, and we are preparing to have our certification this year in December. I believe we are on the right track, but I'm pretty sure there will be other challenges. So from my point of view, this represents a first step for our Romanian breast cancer patients to make sure that they have a more standardized, using standardized management for our breast cancer patients, also having an external quality assurance for our daily practice. So this is about our experience. Thank you, and I'm waiting for questions.
Thank you very much, Nicoletta. So you very nicely describe all the elements and ingredients which are needed to have this more patient-centered approach. But from what we know, this is not very easy to do, to establish. So can you tell us a little bit what it takes you as a young leader? Because when we visited and collaborated, you also you attract a lot of young students, young professionals, your inspiration. So also in terms of education, a sort of leadership, in a sort of new approach. So can you tell us a little bit about your role, your leadership in establishing this approach?
This is a very interesting question, and of course, when you are a female and when you are young and you go to a society like Romania, you are expected to have all sorts of barriers or challenges again. But what I have seen, and I was impressed that my colleagues, after they understood what we are trying to do and we explained it, they started to follow. And actually they understand that we are not trying to change the wheel, we're just trying to make we have to have a standardized protocol for everything, and actually this will make all our lives easier. So this was also very important, and I have to say that the new generation of medical oncologists are very bright, and they did their training abroad, and they also understood the importance of this change. So of course it's not easy, but I'm not here to talk about how hard it is, but actually how hard we are trying to make it work.
Yeah, that's a wonderful example. And actually, you are sort of examples from Romania, but in our collaboration in Net4Care, we have also, if you look in Bulgaria, we have Rosie Krasteva from Uni Hospitals in Panellists. In Poland, we have Alexander Stutner from Wrocław, in a similar role in really engaging all the actors in the sort of patient care approach, but also for young people as a sort of lightning examples on how a sort of new approach, a very inclusive approach to establish better patient-centered care. And that brings us to the second speaker, and Radu Ghănescu. We are very happy that you are here. Thank you very much. And maybe you can tell us a little bit about, from your, of course, what you're doing, but also your experience in what does it take to have the patient involvement, the patient needs into this type of transformation processes.
Thank you, and thank you for inviting me here. My name is Radu Gănescu. I'm from Romania also, and I'm represent the National Coalition of Patients Organizations with Chronic Disease. And I'm a patient. I have a rare disease, so this is the first working networking together, rare disease, chronic disease in the area of health. So as a patient, we always consider that our needs are priority for us, no matter what is the disease. If I diabetic patients, I need urgently access to medicine, to treatment, to services, medical care. If I oncologic patient, I also need this kind of access and availability. So every patient is important, and every patient needs to have this kind of access in their own country. So this kind of example that we saw here with breast cancer, it's a best practice that we can take it and implement it in different other pathology, in different other area in health. So this is what we want as a patient. And of course, there is a specificity. I don't know, sorry for my English, for Central East European country, that we have some health system different than West country system of health. And one of the big differences is that majority of them are public financed. And sometimes the pressure on the public finance in the health system is so big that they cannot handle to cover all the patients in the country. So it's a big difference between West and East European countries. That's why some of the important activities at national level to find out exactly what's working in that country, what is the benefit cost efficient for that country, because we speak about the countries that don't have a high level of income or high level of GDP for health. In general, we look at the European statistic and we see majority of them in the last of the countries or in the first of the countries, depending what we read about it. So that's why some approach need to be different and need to be tackled depending on the system, on the health system. So what we're trying to do, we're trying to see what means European patients means to have access when they need it, to be treated with what they needed in the time that they need it, with the special care by being provided by the specialist and being sharing the methodology of the caring. Now, sometimes in some European countries, East European countries, we still have the paternalist way to do it. We treat the patients because we know what to do. It's our job. So it's a way that the patient is not involved in the sharing decision, is not involved in the policymaker, is not involved in the what should be the process good for the patient. So sometimes we need to change that, and that's what started this kind of networking, because we saw what's happening in Europe and we want to be European citizens and we want to be European patients, and we start to push to have the normal approach. That's what we share and do together to increase the quality of life, to increase the quality of the health system, to increase the access for the patient to innovation, to medical care, to medical services. So we had some good example, and I want to share with you here in this room. One of the example was the Patient Association for Diabetics. So they had a national program, but it was not enough for them to have the holistic approach of the diabetic patient, because sometimes the diabetic patients, I don't want to go in medical details because you are professional, I'm just a patient, have different complications and different other pathologies that make him to have a different problem, not only diabetic problem. So you need to go to different specialists to have a holistic and multidisciplinary approach, and not always is happening, especially in the health system that we have in East Europeans. And was a need, we saw it, and we think about what to do. And we had a memorandum between different patient organizations, a memorandum of understanding, and we all agree that, okay, we cannot resolve everything now, but especially one point, we can take it, put it on the table, and let's see where we're going. So we had this memorandum, and after this memorandum started and was made public, and discussing in public speaking, we start to go to get partnership in this collaboration. And first partnership that we do with professional society that came along with us and say, okay, I agree with you. I know that you need this approach, so we come and we support you in order to develop a way that the patient can benefit in a best interest for the patient. And after that, we start to have projects, we start to have workshops, we make awareness, we make information publicly, media, online, and the discussion was so high level that we start to have meeting with the policymakers. And starting this, we start to have a group. We did have a group of members of the parliament, and in 3 years, we have a legislation for patients with diabetes. So this was the step, and this was the tool that we think that was approachable for our country in the way to change and the way to transform the quality of life of the patient. So this was the first example. Now we have more other example, including with a national plan of cancer. So I think that the importance of the patient organization is the stakeholder that can bring together the other stakeholder that sometimes they don't stay at the same table.
Yeah.
And I know two stakeholders that are very important, especially in the health system, not only in Romania, in every country that you want. The health minister and the finance minister will be so difficult to put them together and to make them understand what is mean not only the cost of the treatment, but what means the quality of life, increase of hope of life, and what means that the patient don't become a patient with disability and become a patient that is socially integrated.
I think this is really a wonderful example. That is so important to be very concrete about the practical issues patients are facing every day. Use this as a sort of input to redesign services very concretely, but also at the policy level. We know that we talk a lot about policies, policy actions, but actually to make it reality for professionals and patients is still quite a challenge. And it's quite encouraging also that in our region, there are many examples where things are happening, not only for oncology, but also other examples, chronic conditions, social care included. So to complete the picture for Romania, because we have now highlighted a Romania example, we have also from a policy level a nice video contribution by Diana Paun, advisor from the Ministry of Health also for the Romanian presidency. So can we show the video? Meanwhile, please put your questions, remarks, questions in Slido so we can take after the video.
Thank you for the opportunity to address you today, and thank you, Nick, for an excellent cooperation throughout the years. Excellencies, ladies and gentlemen, the multiple crises we face in the recent years must not stop us from continuing the fight to go on the right track with our health transformation agenda and our efforts to achieve our SDG goals. Cancer is a striking example. Romania has the worst statistics on cancer in Europe, but these figures say nothing about the suffering and the tragedy that so many Romanians and inevitably their families are experiencing, which creates a vicious circle impacting the quality of life, productivity, and well-being of society. Under the strong call for urgent structural reform of the health sector, less than a year after the adoption of the European plan, Romania has launched its own national beating cancer plan in an event under the high patronage of the President of Romania. In less than a year, this September, the law approving the cancer plan is endorsed by the Romanian Parliament. The timelines of this plan is undeniable. Romania has lost immensely in the fight against cancer. Under the burden of the COVID-19 pandemic, these gaps intensified aggressively. The national plan addresses the need for improving access to diagnosis and treatment and the recovery of care gaps and ensure a rapid transfer of innovation in therapeutic protocols following the care continuum in the holistic approach. Moreover, starting this year, Romania marks the first Sunday in June as the Cancer Survivorship Day to raise awareness of cancer and to rally forces and resources for action against cancer. Due to the sustained effort of the last period, Romania has contributed enormously to the fight against cancer. But I am convinced that it is not enough. European concerted action is further needed. This is an issue that requires shared responsibility and commitment at the highest political European level. The right to health is a fundamental part of our human rights and our understanding of a life in dignity. And I urge you to do everything in your power to implement this right. We need to fight, and we are ready to fight alongside with you.
Thank you very much, Diana. I think also a really nice example on how this cancer plan was established, also in a public-private partnership. So also the industry, the suppliers, devices, products, etc., were contributing in developing this cancer plan together with the patient representatives and the professionals. And this is very nice established in Romania, but we also have these same examples, for example, with, for Croatia, when Emma later on maybe reflect a little bit on the public-private partnership importance for this. But maybe for this part, maybe we already have some questions, Philippa? Yes, please.
There have been some really great and thought-provoking questions that have come in so far. So just considering the previous speakers, the last three speakers, I'll just highlight the most important ones or interesting ones that have come up. So some of them include, what are the key priorities at the local level to deliver person-centered care in Romania? Why is Romania so far behind in cancer care compared to other member states? What is the major barrier? And finally, is healthcare transformation in Eastern Europe limited by the lack of healthcare professionals and workforce deserts? Thanks.
Who wants to respond? Nicoletta?
Can you please repeat the first one?
Sure, yeah. What are the key priorities at the local level to deliver person-centered care in Romania?
Yes, so this was something that I talked with my colleagues and the people that are involved in this area. So what is very important is the need to have data. We didn't have any data. Because, as you know, we don't have a national registry yet, unfortunately. So what I have told my colleagues is that we actually need to implement a very structured software where we can put the data, because we are such a high-loaded institution, but we don't actually know what we are doing wrong, but we don't know what we're doing right. So when you have the data, you have the power. And this was one of the main issues from my point of view, which hopefully is changing. And maybe another thing to prioritize is, as my colleague said, we need to educate our patients, and we don't have to use that paternalistic approach anymore. We actually want to engage our patients, to be educated, to put questions, to find out what is best for them. And another issue that I found, and I have a list and I can go on, is actually access to care, access to clinical trials. So there are a lot of things that can be done, but we need to do it step by step.
Very good. Radu, you also want to respond?
I want to start with the third question about personnel and human resources. I think this is the first issue, because when you discuss about center and dedicated center on multidisciplinary team that can approach person-centered medication health, you need to have human resources. And sometimes, this is another specificity of the East European country, migration of the specialists. Because there is a lot of doctors or nurses that go in the Western country or even more globally because they are professional and they want to increase their income or they want to work in more normal condition. Sometimes this is not possible in the health system that 40, 50 years was under communist time. So we need to develop, but it's needed time to develop, and you need finance resources to develop. So that's why we have an issue with human resources. The second part is that you need to invest in these centers and you need to have a strategy. In order to have a strategy, my colleague was very right saying we need to have registry to know how many patients we have in different area and how is separated in region. Because you cannot have a big center in the middle of the Bucharest and north of the country or west of the country or east of the country don't have access to this kind of center. So you need to have data, you need to have registry, and you need, based on that, to have a strategy to know where invest, and what is the area of your interest in. For example, in oncology, we have a lot different region with only one or two oncologists that cannot make the treatment for all the patients that they have in that area. So the patient is obliged to go to the 200, 300, 400 kilometers to a center to be treated. So this kind of thing is practically, and I came to the second questions, why Romania have so many cancer patients and why sometimes not only Romania and the other East European country, they have this high number of oncology patients. And there is another, let's say not specificity, but another thing that health system didn't think about it, prevention and screening. Prevention and screening make you to have less patients, but not now, in the future. So this kind of program, and if we go and look at how much the health system in Europe fund the prevention and the screening, is too low. 90% of the health spending is on treating, not on preventing, not on screening. So that's why we have a high number of patients, because we don't diagnose in the first stage, and we treat it, and sometimes we lose them because we cannot treat them like they need it. So I think I answered for your questions.
Yes, very good. So we come back to the floor later on. I think had the point of strategy, and you can see the sort of complexity in the strategy to make it eventually work on a local level. It's about service, redesign, improvement, etc. We need the technology and data in place in order to have a sense what's going on, to measure outcome, etc. We need a difference in governance and support of people in order to do the work. Collaboration, the sort of redesign, the leadership, etc. And also the finances. So this is typically the sort of challenges we often talk about in this type of conferences, but they also apply at local settings. And that brings us to the second part of the discussion. And I would like to start with you, with Irma, about the public-private partnership. Have we talked a little bit about that? Because this can only be established with multiple actors, but not only at a European multinational level. We have to translate this more to a local level with local affiliates of partners in order to do this. And this is also a challenge, it's maybe a similar challenge from a health professional perspective. So can I ask you to explain a little bit what you do and what are your views on this public-private partnership?
Yes, of course. But before I jump and answer your question, I would like to say thank you to Nicoletta and Rado, just explaining, how important it is to have a focus, to have a determination, which clearly came across today, and also Diana, and then working in collaboration. You know, it's so important when we are talking about the patient improvements that patients have a place around the same table. And for me, it's so important that we keep this in our mind, that many of us need to sit around the same table, discuss things, and then solve. And who are these partners for the future? It's clear: patient, therapeutic area experts, government, and also public-private partnership is coming here, and here are healthcare private companies. So we all have a role to play. So thank you very much, especially for the determination which came across. So COVID-19 and the war in Ukraine have been a wake-up call for all of us, bringing into the middle importance of the healthcare. And throughout last 2 days, we were talking a lot about the healthcare, but in reality, it is a human care. And the second thing which came across is limitations and failings of the current system. So, willing or not willing to hear it, the healthcare systems across Europe, across globe, simply doesn't work. The system is broken. So what served us well for more than 2 decades doesn't work anymore. That's why, you know, it's on us, it's on our generation to seize the opportunity, to see COVID-19, the war in Ukraine, and also I would say, you know, this healthcare crisis as a catalyst and make things much, much better. And that's a responsibility on us individually and collectively. So now, finally coming to your question, private-public partnership. The European Union recognized the importance of public-private partnership already 2 decades ago. In 2005, the EMI was established. Now it is innovation. I always mix all this. It's Innovation Health Initiative. That's for sure the biggest public-private partnership in health. 5 billion euros available. So half is coming from the European Union, and the second half is coming from the pharma industry via FP organization. Since the beginning, more than 180 projects were funded. More than 7,000 concrete examples were done. So that's one of public-private partnerships we are aware of. The Net for Care started with the Romanian pledge toward the European Union for the comprehensive genomic profiling for all lung cancer patients. And that was the start, and that was the motivation also for other Roche companies in other affiliates in Central, Eastern, Southern countries to step together and do the Net for Care financing as a next project. Because I said the current healthcare system models are broken, and one of them is also how we fund things. So it's clear we need to move toward the direction of value-based healthcare. And here we have, you know, few countries collaborating with: Greece, Romania, Bulgaria, Poland, and Hungary. Just realizing that there are more things which we have in common than we probably thought. And I would like to showcase few examples from specific countries, but I don't have time to really go into the details, but I'm inviting you, if you're interested, just come back and I will play a connector role and move you to the right person. So Bulgaria, for example, throughout the public-private partnership, finally they have the National Cancer Beating Plan, Bulgaria was one of the countries which didn't have this, but it is possible via public-private partnership. Croatia, that's really the example, I love it. So through the public-private partnership, each newly diagnosed metastatic cancer patient will be diagnosed with a comprehensive genomic profiling. So they establish laboratory within the University Hospital Zagreb, which will cover patients from the entire country. And then this data will be moved to the database. We heard how important it is, and they will be treated with the molecular guided treatments. Can you imagine all newly diagnosed? And then I'm coming to my own country, Poland. So last year in June, Warsaw Health Innovation Hub was established. The medical research agency, together with private companies from the healthcare industry, Microsoft, IQVIA, Roche, AstraZeneca, we were like the first one stepping together and just realizing there is so much we can do for patients. So these are just few examples about the public-private partnership. But why we are doing, from where the motivation is coming? We have heard that cancer is a problem in Central, Southern, Eastern countries. Independently to which country you look, from Romania, Hungary, Poland, we are really high with the mortality rate. And just example, lung cancer mortality rate in Poland, every year, more than 23,000 patients are dying. And if we are able to save one life, it's worth to do it. And that's what I want just to share today.
Yeah, wonderful. I think this is very nicely illustrates also the effort from private partners, industry, to work together in improving health. And this experience over the last years, it was really nice to see how the sort of trust and collaboration established, and also across the different countries, and not limited by one company, but a range of stakeholders from the private sector, including also device in the industry, MedTech Europe, FPA, were really also important in this. And this is also a sort of process in development. We all learning about how does it work to deal with trust, shared responsibility, accountability. So it's not always easy, and a lot of interest obviously involved. But as what Irma also said, like we do understand the existing models or the traditional models are not longer sustainable. We have to work together to a new kind of model, a value-based model, if you like. So gradually we're coming more to the policy level. And before we go to Svetlana Nicolescu, I want you to show you a video from one of our dear colleagues from Bulgaria. It's Alexander Simityev. He's a pulmonologist, but also a member of the Bulgarian parliament. And one of the challenges we have in our region is, of course, instability, political instability. I think the turnover in many countries is less than 6 months for health ministers. Which, of course, poses a real problem for long-term policy planning. And as you know, healthcare transformation improvement is very reliant on long-term planning, along with, of course, short-term. But Alexander will say something about instability, volatility in systems. So can we have the video of Alexander?
Dear Professor Goldemont, dear colleagues and friends, my name is Alexander Simityev, and I am a Bulgarian physician, and I have also been a member of parliament in our country, which is where I started paying more attention to what our environment adds or detracts from healthcare. Now, change is a constant, it is a given, and there is nothing more permanent than change. But alongside change, we also have something which we call volatility of the environment. And volatility is something which actually hampers us from achieving meaningful and sustainable change, which is why I tried to look at the elements which increase volatility in our environment. And if you would be interested, I can elaborate on this further. Thank you very much for including me in this discussion in the Stein Healthcare Forum.
Thank you very much, Alexander. So we have on the website a more elaboration on this topic by Alexander. So we don't show it in this session because it takes too much time, but it's really spot on explaining the challenges a lot of our countries are facing. I think one of the achievements and smart way to work with existing structures and to build, to work around this instability, try to establish stable structures. I had the example of Alexander was his initiative to establish a parliamentary commission with a mandate of 6 years. In order to be able to have at least some of the elements of the sort of policy planning to be more consistent over a longer period of time. So accordingly, of course, depending on the type of country, we should also think, well, this sort of instability, volatility will be there, but what are other ways how we can make this policy planning, the action and implementation more stable? Having said that, if you look to our region and look into Svetlana, I think the importance of our region, but also the pan-European region, also thinking about Armenia, Georgia, Moldova, your country as State Secretary, not only as chair of the Southern Eastern European Health Network. What are your views on networks, on your own network, but also the network Net4Care, and there are also other networks? How can we benefit from your network, your knowledge and expertise, and how do you see further collaboration in the coming years?
Thank you, Nick. I will start with the key word of our session, collaboration or cooperation. And I really appreciate that we have started our discussion with the perspective from the health professionals and with the perspective from the patient. Again, many thanks to Nicoleta and to Radu, because we have already had how important is to have at the country level, at the very basic level, cooperation among healthcare providers. And well, our today discussion is framed around the cancer, but this applies to all the major public health issues that our country are dealing with. We need multitasking teams. We need this cooperation among healthcare professionals. We have heard from Radu afterwards how important is to engage patients as equal stakeholders at each phase, at the phase of policy development, at the phase of strategy development, but also the implementation. We also already touch upon the importance of some of the stakeholders playing the role of mediators between the key stakeholders. And it has already been said today how important is to make the health minister talking to the finance minister. And sometimes it's someone in between who facilitates this dialogue. We already touch upon the importance between public-private partnerships, collaborations, initiatives focused on the same goal and on the same objectives. Now, I will bring you to the next level of cooperation, still structuring our ideas and reflections around cooperation, but this time I will talk about the cooperation or collaboration cross-country, intergovernmental, and today I have the privilege to speak on behalf of the 9 member states of the Southeastern European Health Network. This is an intergovernmental organization, regional organization, which includes currently 9 member states. It has been founded in 2001 as platform for knowledge sharing, as platform for cooperation and collaboration with a clear mission. And the mission of our organization is to encourage mutual efforts towards peace, health, and well-being. And I'm absolutely sure that all of us, throughout these 2 days, we have internalized how important are these things for our region currently. Now, how we, as governments, facilitate this type of cooperation and partnerships that we already started with. Because the role of the government is to create the policy that will enable all these types of cooperation that we already understand the importance to have them at the local level. The role of the government is to enable and to make sure that our policy is in favor of this cooperation. And we do this within the network, operating at different levels. We do operate at the policy level because it's intergovernmental. We have a pledge signed by the ministers, but the next very important level of cooperation that our network enable is technical cooperation, because the change will never happen if it will remain, if it stay at the level of policy. The real change will happen if we take it down to the translating the policies into the practice. So we need this technical level cooperation in order to translate policy into practice, in order to translate health in all policy in practice. And how we already have heard during this forum, the importance of translating health for all policies into the practice. So this is where we focus our efforts and our energy within the network. I also would like to touch upon the aspect that the Southeastern European network, it is built upon the existing strengths of its member states. And we do this and we translate this by having established in each of the member states the regional health development centers. So we take this specific strength that our member state have and translate it into the common good, into the regional knowledge through knowledge sharing, through knowledge exchange that happens at these different levels. And another specific aspect that I would like bring today into this discussion is the membership and the representativeness of our member states. And the beauty of the network is that we include member states who are already members of the EU, and we also have countries who have this aspiration and this clear determination to become closer to EU, similar to Republic of Moldova that I also represent within the network. So having these countries placed at the different phase of this trajectory towards the EU, it's very important to have this interaction among the member states within the network, and speaking and interacting at the very equal level, and making sure that this interaction takes place, and it actually helps us to ensure the transformation of our health system towards more patient-centered. And I just very briefly will reflect upon the question that already has been addressed to us. What needs to be done to ensure this transformation? I think that we all, from the level that we can, have to ensure that in the center of our health system is the patient. So we need to structure our health system around the patient needs, because the patients that we are dealing with either at the level of the healthcare providers or at the policy level, they have a lot of medical but also non-medical needs. So we need to make sure that our health system can address not only the immediately medical needs, but also these broader social determinants of health. And this needs a lot of internal transformation within our health system. So I hope that our network provides this opportunity to our member states, and all our next efforts will be focused on this. Thank you.
Thank you, Svetlana. I think what you're saying, this interaction with different member states, but also at different levels, in more policy, more technical. So what do you think would be needed to make this more stronger and impactful? So how do we arrange this? What is needed? Conferences like this? Do we have to organize workshop? What do you think? What do you need?
Well, we need a lot of things, but first of all, we need engagement from everyone. Once we have this very, let's say, sincere, or the one that comes through our values and that is based on our commitments, continuous engagement. I also would very briefly reflect on what the distinguished MP from Poland have said on the importance of having consistency within our systems. Indeed, when we look on the member states of our network, all our health systems are very fragile. They are even more fragile than the other countries from the region. And we also have this political instability. It's something that also unites us. And in this regard, it is very important to ensure consistency in our goals, consistency in our agendas, and the financing investment that we direct towards our agendas.
That's a very nice reference to health for all policies, and also as an enabler for creating stability and working on this goal of better well-being for people, for citizens. Emma, how do you look from an industry perspective? So how would it work to contribute? We have this wonderful experience also with some of your colleagues with Roche. We're really dedicated over the last years in working just in healthcare system transformation. So how can we further accelerate the sort of public-private partnership collaboration in this respect?
So I would say throughout the discussion we have, it's clear that we cannot solve the problem in isolation. So we cannot stay in silos within the countries, and we cannot work like country only. So I really love when you said 9 of us, 9 countries together. And that's probably the direction we need to go, because there are so many good things, we can scale it up. So firstly, it's good to know what's going on, leverage what is available, and it's working well. And the second point I would like to stress is we should have equal voice, because we have so much to share, we have so much knowledge, and I hope that one day we will not talk about a public-private partnership, but just about partnering and working together for our patients, for healthier Europe. So that's what is my dream, partnering. And Roche and entire health care industry, we are just one of partners. That's how I'm seeing the future.
Wow, very good. That sounds like European Health Union sort of approach. And before we go to the next level, the European Brussels level, if you like, there might be some questions from the floor here. Do you have some questions? Yeah, I see their hand raised. Do we have a mic for that?
Yeah.
with multitasking Philippa. Thank you very much. Very talented.
Thank you very much. My name is Susanna Palkonen. I am here representing EFA, European Federation of Allergy and Airways Diseases Patients Associations. I also have another hat in PACT, Patient Access Partnership. But I would love to ask from the panel, and especially our patient representatives, that as European networks and disease-specific patient groups, what can we do that we are not doing today to support the kind of action that you are not only making in your geographic area? And are we doing something good? What could we do better? It would be lovely to get it directly from you. Sometimes we can't even reach patient groups in our disease areas in this region, although we have capacity building opportunities. So help us to be involved in the positive action that you are making, if you need us.
Thank you so much. So, Radu, you on the spot. I think it's a very good question, and also had this sort of willingness to understand. It's very good. Yeah.
Yes. Thank you, Susanna. There is a lot that you can do, if you ask me, in order to help our community, our national level, to improve, let's say, health access and improve person-centered medicine. And I can give you an example. And the first example that is in my mind is European Beating Cancer Plan. When the Europe look at the cancer as a problem, they started to put it on the first row and develop this Beating Cancer Plan. What we saw in the East European countries. Almost every country now from East Europe have a national cancer plan. This was not, from my experience in the National Patient Association, was not possible to do it because we discussed about national cancer plan since 2010, 2011, I think, in national level. But it was unable for me to increase the awareness and to make the pace to have the national cancer plan. But with the approach from the European Commission, with the approach from European Patient Organization, with the approach of the European Scientific Society, the direction was to improve a national cancer plan. So it is an example for me that helped me in my national level to develop something that I did not do possible to do it. It was not possible for me to do it. And I have another example. A couple of years ago, the Commission was putting on the first, let's say, first thing as approach, rare diseases. And after that, Romania, I remember very well because I was participating in that event with health minister, had a national plan for rare diseases. So this is the way that it worked for Central European country. Maybe not for all the country, but for my country it's working. And it's an example. Sometimes it's working, let's say, with different approach from country level, going to the policymakers and going to Brussels. Sometimes it's working even that way, but it's much slower. And I think this is the why we need patient organization, European level, to have a different approach with different institutions, with different methodology of working, and patient organization and national level who can do what they are able to do in the national approach with policymakers, with the parliament, member of the parliament. So it's different advocate level, but interacting provided a positive result.
Mm-hmm. It's a sort of guidebook for to establish a patient organization representative, because I suppose that sometimes can be quite difficult. How to reach out to countries, to patient representatives who could contribute? Is there sort of experience which might be helpful? Or
sometimes it's difficult to develop community of patients. That's a problem, and especially in some countries in East European. Majority of the patient organization, they are sustainable because they are working with industry, and we know that. And industry is one of the powerful stakeholders that help patient organization to develop. In other countries, there is other possibility, for example, in European country, where the policymakers make the patient organization as a member of the same table as a stakeholder, and they participate in develop policies and develop regulation and different legislation. It's not happening in East European countries. Sometimes in East European country you need to develop a community, and it's very hard to develop this community in patients to make it professional, because when you go to discuss with the National Drug Agency, you have to know about HTA, you have to know about clinical studies. If you want to discuss with National Health Insurance, you have to be very professional in the way of how it's reimbursed the medication, and how is the national program developed, and how the service care are provided and reimbursement. So you need to have a lot of level of discussion, and to do that you need to invest in the community, and to invest in community you need human resources and financial resources.
An important message, I think. It's a dedicated investment. So, for sake of time, I suggest we continue with the European level. We have a poll on Slido with the questions, so maybe the audience can refer to that, can respond to that. How can we make a person-centered healthcare service a reality for all citizens across Europe? I think it's a multiple question thing, or answer, multiple response question. Yeah. Anyway, so we will continue with the discussion. So you have some time to fill in the questionnaire. So I want to continue with Carmen Laplaza. We know each other quite for a long time in European projects, and you heard about the sort of local activities, improvement, innovation, redesign, role of professionals and patients, as well as public-private partnerships in that respect, the sort of cross-country collaborations. So what is your perspective from DC research and experience with European programs on how do relate these programs to the things you hear, and how the Commission can support this? And
Thanks. Thanks a lot, Nick, for the question and for the invitation to this very interesting session. I must say that I was quite in the line of what Svetlana was saying on the importance of translating policy into practice, because we see it from a research perspective exactly in the same way. The importance to fund a research that is going to be translated into practice. Otherwise, there is no use. We just do not want just to publish academic papers that will be in a drawer. So for me, in healthcare, there is only one way to implement research results into practice, and it's through the involvement of healthcare professionals and patients. So I'm really happy of the central focus that healthcare professionals and patients have in this session. We really believe in a demand-driven innovation, so without your involvement, it's impossible. So healthcare systems transformation is a priority for the European Commission. Different programs are looking at it. I can mention the EU for Health program, where this is one of the 4 main objectives. But of course, I will focus on the research side, and I'm very happy to announce that we will be launching a new partnership, quite ambitious budget, 300 million euros, early 2023, precisely to support the healthcare transformation, healthcare systems transformation. So the objective of this partnership, which will be mainly public-public, we are also involved in the Innovative Health Initiative, but I will mainly mention this public-public because it is precisely about the need for cross-country collaboration, not only at the level of countries, but also at the level of regions. So the main aim of this partnership will be to contribute from a research and innovation to accelerate the transition to sustainable, resilient, innovative, high-quality healthcare systems with a patient-centered perspective. This is the most important part of what we want to achieve, patient-centered. And the reason why we give a lot of importance to that is because we do not believe in a sustainable transformation of the healthcare systems if the patient is not in the center. The patient needs to be empowered. It will need to be taken care of course, but before that, it needs to really be able to take care of himself. And there is a lot that you can do in order to support that. The reason why we believe that cross-country collaboration is essential is because the challenges that most of the countries are facing are the same. We need really to think on what the future of healthcare provision will look like. We know that hospitals will not be able to accommodate the needs of all the patients. So we need to think about a real integration of care, real integrated care with a reinforcing of the primary care, with the reinforcing of the community-based care. We also need to make a space for prevention. Really, prevention, we talk a lot, but how are we going to make a space for that? What about the efficiency? Let's be honest. This sector is still very inefficient. There are many inefficiencies, and what is worse is that there is already a lot of evidence on the possibility to really tackle that. There are many successful practices already which have demonstrated also the cost efficiency. So, and let's not forget that the future will be even more complicated. Let's look at climate change. The way we are thinking about healthcare is going to be significantly affected by climate change. Extreme weather events are going to be more and more recurrent. So we need to prepare for that. We need to be more resilient, and all that cannot just be tackled by one single organization. We really need to collaborate. It has already been said earlier, and it's really fundamental. So this partnership, which is, I think there are around 25 countries that will be part of this co-fund. And there is time to join, because there is still a space for more. We have partners from the South Europe, from the Eastern Europe, but there is still a space for more. So I think I would really like to invite the representatives that were here today to engage with us and see whether they can join. But the main thing will be that we'll provide a pool of European, national, and regional scientific resources to research, many things still to be researched, but also to develop and test innovations also from an organizational perspective. One also important thing that was mentioned was the importance of sharing the best practices to help uptake those practices that are already benefiting some patients, but that our aim would be that all patients in Europe can really benefit from the best care. So the uptake of innovation, the sharing of best practices will be one of the important pillars as well of this work. And just to finish my intervention, I would like to say that one key element as well is that a credible transformation will also need to be green. So if healthcare systems would be a country, they would be the 5th polluter in the world. So there is also a responsibility on our side to ensure that whatever transformation we will do will pass also by looking at the impact in the environment where we live.
Wonderful. Very nice, Carmen. I think also I like very much how you're sort of putting the European citizens, the people in the center. And of course, the Commission provides a range of instruments and programs on different themes, but I think this importance from what actually do we want to achieve, I think is so important. Of course, this should translate into more concrete and specific actions for which the Commission has also the support available. Because in these sort of programs, we have a lot of experience built up in the EU over the last 10, 15 years. Are there some things you look back in the last years on what you think, okay, this has worked well, and this we will continue or further strengthen, not to reinvent new approaches or instruments, but to capitalize on what's already there?
Yes, indeed. As I was saying, a lot of good things are already there. And of course, this needs to, whatever efforts in the future need to build on what has already been successfully deployed. We can look at what has been done in the past in the context of the European Innovation Partnership on active and healthy aging, for example. A lot of already interaction between different regions in order to further build on the knowledge of others. But we could also point at, for example, successful innovation procurement practice that we have been funded and that we have been working around the sharing of needs from procurers collaborating together through different countries, and that together have benefited from EU funding in order to have suppliers looking at how best to support the specific needs of these procurers. There are very beautiful examples in the context of integrated care, for example, and this obviously is one of the elements on which future interaction at cross-border level can also build on. One thing important that I would like to mention as well is that an important change that has happened with the setup of Horizon Europe is that now you can use structural funds in order to participate as a country or a region in order to participate with your co-funding part in this kind of partnership, because indeed the challenges are basically more or less the same, but the resources are not. So from our side, we give a lot of importance to have as many partners as possible for all Europe, and that's why the participation of structural funds to facilitate the transformation of healthcare systems, it's an important part as well to be considered.
Yes, wonderful. For your knowledge, the European Innovation Partnership on Active and Healthy Aging was an initiative launched about 10 years ago. And there were 80 regions involved across Europe, more than 1,000 organizations from companies, universities, municipalities, etc. The whole program started with almost no funding. It was just a sort of mission on, okay, how do we create a sustainable, healthy, aging society? And it only shows that the strength of mobilizing people on a regional, particularly at the regional level, was so successful with relatively, let's say, financial sort of input, but very much about the vision, about mobilizing people, support in collaboration. So that's also a very helpful thought, that we have this experience. So thank you very much. And now we come to the political engine of Europe, the European Parliament, and we are very happy and honored that we have István Ujhelyi, member of the European Parliament from Hungary. István, you listen to all the elements, the really local, very concrete.
Would you like me to analyze it or finalize it?
No, what I would love, or we love to hear, I think, is your vision on this collaboration. Why it's so important that we need this European collaboration, European Health Union initiative, in order to make it work, to make Europe more sustainable and better improve lives of people. What is your take from a political point of view?
Thank you so much, Nick. And first of all, I would like to say thank to the Gastein movement and the host, because this is the first time when I'm invited, and I told them I would like to be here the next 30 years. So immediately I will try to find the best room for the next year to have this wonderful community and to be part of it. I represent the European Parliament because I was one of the initiators of the European Health Union project before the COVID. So it was 5 years ago, about 5 years ago. But also I'm coming from Hungary, so from the Eastern European part of the European Union. And I would like to tell you here in Austria, to the Western European colleagues, it's not about and not because of the difference between the poor Eastern European countries and families and the rich Western European countries and families. No. It's about the united European Union. Because if you like to have one happy, strong, and healthy European Union, then we have to find how can we solve those problems, what you got today and what we see and what we live in our countries. Yes, we had a different history the last 50 years. Yeah, that's why we have a totally different public health sector. We had totally different cultural backgrounds in our societies. But if we need one united Europe, then we have to find how we can solve all these problems. That's why I would like to give you 3 examples, no more. Is that okay that a European citizen could get 3 times more likely a hospital infection in Hungary than an equal European citizen in Germany? I think it's not normal. Is that okay that the number of nurses is far below the OECD average in Eastern Europe? In Hungary, for example, there are slightly more than 6 nurses per 1,000 inhabitants, while in Germany this number is 12. Is that okay that EU citizens have different chances of detecting their possible cancer in time? It depends on which side do you live of our not existing borders. That's why, together with some professionals, for example, former Minister Mihály Kökény from Hungary, we wrote the first position paper to the Parliament some years ago to talk about the European Health Union. And yes, the pandemic situation was terrible for us, but also opened some gates and doors. And now the European Health Union program is the new pillar of the European integration. And yeah, I know very well the member state governments don't want to speak about the competencies. Okay, then don't speak about that, but make actions. For example, the European Cancer Plan, the European Mental Health Program, the EU for Health budget, which you have to know that it's a much bigger budget than in the previous European budget. This time it's 5.4 billion, and it was less than 200 million in the past. And we fought about it. Yes, it was a big fight. But now the question is, how can we make actions? And how can we involve the Western European countries or North European countries? There were some ministers from, example, from Scandinavia, who told me, come on, Mr. Ujhely, we don't want to have any kinds of minimum standard in the standard quality decisions when we are talking about the European public health services, because they don't need it. Yes, and they would like to invite our nurses, our doctors from Romania, from Poland, from Hungary, from Czech Republic. But we also need them, because maybe one Swedish company would like to have any kinds of investment in Romania or in Hungary, and they would like to send some Swedish manager there together with the family. Then I think they need the same quality of the medical public health service like in Sweden. And also when my son is a student in Brussels, he needs the same quality. And maybe, I'm not a professional doctor, my parents were doctors, but maybe the protocols, for example, in the treatment protocols, also, I think it would be better to have some kind of cooperation between the member states. So when we are talking about the European Health Union, it's a huge new pillar of the European integration. I'm talking about the patients, I'm talking about the workers in the health services, and I'm also talking about the industrial background, because we learned because of the COVID, we, the European Union, we need own independent, own European health industrial background. I don't want the European Union to ask the states, United States or China or Israel or any other countries to give us masks, to give us any kinds of equipment. We need a strong European industrial background. So this is the European Health Union project, and I hope that all of you, and all the colleagues here in Gastein, you can help us to fight about it. Because if I ask any professionals in Hungary or in Brussels, everybody very happy about it. When I ask the politicians, they don't want to support it because they have a feeling about that. It's a member state competence. They don't want to give any chance to the European level to make decisions about it. So this is my answer, and I hope that in the European Parliament we can collect more and more colleagues to fight for it. I know in the European Commission we have a very, very strong partners. Also Ursula von der Leyen, President, and also the commissioners. So I think it's a real revolution for the European integration.
Thank you very much, István. And thank you very much for pointing out also the sort of challenges and also why we need this sort of union and the approach. But first, before we go to Irma, so do we need to change the narrative to convince the others? Maybe use different arguments, as what we learned during the conference. Everything is so much related. Climate, economy, but also health is also the economy. If you think about productivity of the workforce, etc. So it's interlinked. Investment in health is also investment in the economy. And maybe Irma could also further complement to that. You wanted to respond?
Yes, thank you. I want to respond what István said, but now you have another one. So first, István. First of all, thank you very much for bringing, what are the differences between Central, Eastern, Southern countries and Western Europe. There are huge differences between us. And I just realized, that majority of us are coming from these countries. And if we will solve the problem on our own, I'm not sure we will be able to solve it. And here I would like to say Net for Care initiative started with Roche, and there we have a great support from Germany. So that's something what we will need to do, move this Western and Central Eastern countries together. Because what we cannot accept that where you live will determine whether you live. That's not true. That should not be true. So we need to kill, it seems, another silos which is growing up. So thank you for bringing this to the space. And then you start with another topic. My opinion is, if we will see healthcare as a cost, still, we will not succeed. So healthcare should be like investing in healthcare. We will increase our economic profitability, and we will be even better in the performance. Because healthier population, healthier Europe could be the biggest competitive advantage toward others. And you mentioned this too, what you don't want. So that's how I'm seeing, you know, moving from seeing a cost to seeing as an investment, to improving health.
Very fair point.
First of all, as a European citizen, I would like to tell you the equal and good public health service in our citizen right all over in the European Union. If we have free movement, then we need free and the same quality health care service everywhere. The second one, yes, we have to invest to the people. That's why when we are talking about the education or about the public health, it's investment, it's not cost. This is the answer. But how can we talk about it when we don't have enough money for the European health programs in the European budget? Because it's a member state competency. So we have to fight for bigger budget, also bigger support from the European Investment Bank to have more and more projects, private partnership programs. And we have to ask the governments, and sorry, it's internal political problem in Hungary, I'm not from the government party. But we have to tell them, come on, to be in Europe, it means we need the same democracy and the same rights, for example, when we are talking about the house structure. My government told me, come on, Mr. Újhelyi, we don't want to give any kinds of decision possibility to Brussels. I told them, come on, the European Union would like to help us to give better service for our people. So this is the political problem all over in Europe, but the answer is yes, this is investment to the people.
Yeah, that's a very good point. Also, have we discussed over the last days also a little bit the sort of populistic movements across Europe and the globe. Also, how they take this health or social issues for their sort of program and narrative. So partly it's also for governments, and probably also had to retake the sort of social topics for a real concrete message which can deliver to people in order to fight a sort of negative populistic developments. So partly that's also our responsibility in order to have these discussions, the things we discuss on the conference, translate into understandable messages and also concrete actions which can help politicians in order to deliver to their people. So we have still some room for some questions. So let's look at the word cloud. So it's nicely, I think, reflecting the things we discussed. It's a very much healthcare transformation is a very local activity. It should happen local. Policy, of course, should deliver eventually on a local level, where training, education, as mentioned by Radu and Nicoletta, we need, of course, all kind of requirements, things, ingredients to make it work, data. So that's quite interesting. I look at Philippa. So do we have some short summary of points?
Yeah. It's been a very lively, very active Slido. They're here this morning. So there have been, I'll just highlight and give a flavor of some of the questions that have come up under some common themes. So there were a few questions relating to equity. So participants were wondering whether we should more proactively redistribute funds to regions with more health inequities. What is the main barrier we need to tackle to address inequitable health service across all EU member states? Some questions about patient-centered care, which came up a lot within the discussions. So some of of those questions were addressed, but people were wondering whether a European Health Union will support transformation in Southeastern Europe specifically, and how will it benefit health service users and patients, and whether there are any cultural differences to factor in when implementing person-centered care across the different member states and at the local level, and whether one size fits all. There was also a lot of discussion about the learning hubs and translating all this learning into action, and people were asking about that. And one person was asking whether there are any good knowledge sharing hubs across Eastern Europe. And finally, there was a question about how we can ensure transparency in public-private partnerships as well. So.
Thank you very much. So one thing triggered me, this equality topic. Also thinking about Ukraine, about Moldova, about Kosovo, non-EU members, but still bordering countries, also countries we have strong ties to. So Svetlana, so if you think about establishing equality, and what you heard from the Commission, the Parliament, so how do you see the role of these countries in this sort of movement of European Health Union?
Well, as we already have talked within Advocacy Forum, and just to reiterate again, since the countries like Moldova are impacted by the policies and by the practices within the health systems of the European Union, we do firmly consider that we need to be part of the solution as well. So it is critically important that we are engaged and that we are involved. I mean, any country that is impacted. And we have to discuss together. We have to find solutions together, and we are ready to stand for this. And in this way, I'm again firmly convinced that we can achieve these collective benefits for everyone within the European Health Union. Thank you.
Thank you very much. I think that's a really nice concluding remark, also looking at the time. We're running over time. I think the discussion was very rich. Addressed the different dimensions which are relevant for Europe to transform from very concrete, from a professional perspective, a patient perspective, the importance of public-private partnership, and that we do have industry at our side, and we can't do without them. And it's also the credit. I think that this sort of thinking, also the courage to really work on this trust with public partners is, I think, is really good. I think also this more broader collaboration and this engagement with networks, activities already ongoing, and how we can capitalize and make the movement stronger. It's good to know that the instruments and programs are available. So partly it's also how do we use this in an efficient way, effective way, and work together on this. So that's also quite helpful, and also how the Commission is reaching out and supporting also member states, but also in the individual organizations, and then we have the political level and the importance of the narrative, how to engage, where the politicians like Istvan can play an important role to inform others, to engage others. But of course, Istvan is also should be supported by how can we make this concrete. The policy should translate to what we deliver to people. And maybe a final anecdote. In 2017, in early spring, in Moscow, the Russian government was gathering all the ministers, also from Republic, ministers from health, from the economy, infrastructure, education. A huge event. And they were thinking about what would be the narrative for future Russia for the elections, because they were worried about the unrest among people, especially in the republics, in the remote areas, not in the cities. And accordingly, they built a program. a program which was built across the ministries. It was very innovative. Cross in the departmental groups working on topics, and it was what we would see as very much the ingredient we would like to see in policies. It was a very hopeful moment because it was a sort of starting point. How can we improve lives of people and social care included? And we know the course of events. The narrative changed gradually also in the pandemic. So, and we are incurring a very emotional, terrible situation. What it I think learned was that you can have wonderful policies in place with actions and good intentions, but eventually it should lead to real change. And also, working for years in Russia, the changes can be really difficult. And of course, we can agree on the models and the implementation, etc. But eventually, it should deliver. So, I think the sort of challenge we have, we should make more effort to make things effective. And if we are back on Monday, after really full of inspiration after this conference, it would be wonderful if we might think maybe we should do a little bit things different to make a real impact, and also should look for this collaboration. I think, panel, thank you very much also for your thoughts and also this thinking about collaboration. Also all these from very concrete to more policy aspects. I hope this is a sort of message. Thank you very much, technical staff. Thank you very much, Gastein and Dorley, for supporting this. And I hope to see you soon again, and hopefully much earlier than the next conference. Thank you very much.